Yes, I'm pleased and I'm honored to be here today, and I look forward to our exchange. I think Forte is an excellent initiative in this country to promote the dialogue between research and practice concerning work and health. Now, today I would like to talk about healthy work in a globalized economy. And as you can see, I put a question mark because there might be some challenges and some open questions. Now, we already heard earlier this afternoon what good quality of work means. And we can say at least what we know from everyday experience and from science, that continuity, security and safety of work and employment is an important condition for good quality of work and employment, fair pay and basic social protection, the opportunities to develop your own skills and your career prospects, and also the experience of autonomy and control and of respect, lack of discrimination and recognition is important. I will, in the 25 minutes I have, try to answer these three questions. First, how does economic globalization affect the quality of work and employment? And then second, are there negative consequences for the health of working people due to these new challenges of economic globalization? And finally, if so, how can they be prevented or at least reduced? Now, what do we understand by economic globalization? And I think we should very briefly check the few core features. First of all, free market principles and technological innovations spread over the world with large flows of transnational capital, trade, and also workforce. And this process is actually dominated by transnational corporations, mostly from the US, from Europe, and from Japan, in fact. And it is supported by international organizations like the IMF and the World Bank and others. Technological innovation today, that in particular means digitalization and global diffusion of information communication technologies, which are transforming work and employment in unprecedented ways. At the same time, globalization means the expansion of neoliberal policies which promote the deregulation and the flexible employment, and thereby weakening trade unions and also national labor and social policies. It is important to mention that globalization produces both some positive effects like economic growth in some countries, but also some negative effects. And I will focus a little bit more on these negative effects in my talk. And these outcomes, positive and negative outcomes, they are unequally distributed across the world. For instance, here in the high-income countries, in the more privileged parts of this world, we experience economic growth, increased wealth, technological progress, relatively good safety, health and protection standards, and also the insurance of workers' rights. But in the most of the low and middle-income countries, there is economic stagnation, there's poverty, there's unemployment, or at least informal employment, and a lack of basic safety, health, and protection standards. I will not go into details, but it's quite shocking to see that almost 2 billion of people working worldwide, working in informal employment, which means that there are no basic social security standards. How does economic globalization affect the workforce in high-income countries? And I think here it's clear that we face increased pressure of competition, of rationalization, due to this competitive market with a transnational labor market. The main effects are downsizing, merging, and outsourcing, due to automatization and digitalization. Now, for the single workers, what does it mean? It means there is an intensity in the work to be done. There is increased job insecurity, and also for some professions and occupations, risks of job loss. And there's also at least a rising income inequality and a substantial portion of people suffering from low wages. Is this true? Does it take place in Europe? Now, we have on this slide, you can see what happened during the crisis, the financial crisis of the 24 to 2010 period, or 28 to 2012 period, actually. And you can see this is from the European Social Survey. You just take the Nordic country, for instance, and you see blue is 2004 and yellow is 2010. And you can see a doubling of the proportion of people who say, working people who say their job is basically unsecure. So there was a raise from about 15 to about 30% of employed people, not only temporary, but fully employed people suffering from job insecurity. What about Sweden? Sweden is one of the countries with the best developed social policy and also extended welfare states. For everybody is the situation at work very privileged. Now, we have some answer on the current working conditions in Sweden. This is a survey which was published 2 years ago from the Swedish Work Environment and Authority. And I just picked up 2 or 3 from these slides, or facts from this report. And you can see that every third working woman and man is still confined to shift work, that mentally stressful work is quite prevalent, that there is a lack of support at work, and fearing of job loss, we just talked about it, is also there. Although Sweden is probably champion concerning gender equality, we still have some gender segregation, according to this report, such that, in particular, in the highest positions, there's a majority still of managers being men, and also women are overrepresented in human service occupations and in the public sector. Now let's go to the second question. How do these working conditions affect human health? And I think there are 2 overarching conceptual aspects where we can focus, where we can find answers to these questions. And I would like to call them, there are threats to control, there are threats to autonomy, and this is one of the 2 aspects I'm going to talk about. Threats to control means many people are forced to work under pressure, with overtime work, with heavy competition, and they are overtaxing their resources. There are also blurred boundaries between work and non-work sphere, in particular with the new technologies. There are, for many people, lower skilled people, predefined jobs with monotony, Mac jobs, and for many of us, there are economic constraints due to restructuring and downsizing. So threats to your autonomy at work and to your control at work. The second overarching aspect is, I would like to call, there are threats to social reward and recognition. What do we mean? I mean, if your job is threatened, if there is no continuity, if there is no standard employment, we heard about it in an earlier lecture today, if there are poor promotion prospects or even forced job changes, which you don't like, if you are paid unfairly or treated unfairly without respect, without support and solidarity, because profit only dominates the culture in the enterprises, then these are all threats to social reward and recognition. Now the question is, how does it affect health? How does it affect the body so that people really suffer from diseases and disorders? And to answer this question, we need so-called theoretical models of stressful work. And I will just very briefly introduce 2 such models, because these 2 models were mostly studied in epidemiological studies, and we have a lot of empirical evidence. The first one is the well-known job strain or job demand control model. Many of you may know it. So it's not just the manager who has much work to do, but it's the one who suffers from high demands, but at the same time also from low control and low decision latitude. And how does it affect the body? If there are things to be completed, but you don't have control, you are not sure whether you achieve, then the stress axis in your organism is activated, and this leads to the secretion of stress hormones and of the cardiovascular activation, and in the long run, this may affect your body. The complementary model is the model of effort-reward imbalance, which we have developed in our group. And as you can see, it doesn't deal so much with the job task. It deals much more with the work contract. So what are you investing as a working person, and what is the payoff that you receive for your achievements? And as you can see from the slides, there's an imbalance. There's heavy effort and not enough reward. And importantly, we have 3 dimensions of reward. Of course, money, but also status, which is the security and promotion prospects, and then the non-material dimension of recognition and of esteem. And again, here we know from neuroscience now that the brain reward system is affected by not only by physical pain, but also by emotional pain. And so these pain areas are activated, and the stress process is continued. Now, we can measure these 2 work stress models, and we have done so, as many others have done as well. And you can see, if we take just the mean scores of how stressful the work is in different countries, you can see Sweden is on the top, together with Switzerland or Denmark, which means it's the best quality in terms of these 2 work stress models. But you can also see that Eastern Europe and Southern Europe, like Czechia, Portugal, Hungary, Italy, they have a very poor quality of work. Now, what are we going to study, and why are we going to study associations between job stress and work? As you can see, by the year 2020, which is not far away, depression and coronary heart disease will be the leading causes of premature death and of life years defined by disability worldwide. And this is an older prediction, but it has been reconfirmed more recently. So what are the relationships between working conditions and the risk of suffering from one of these disorders, cardiovascular disorders and depression? And I think the evidence science is providing is important, because many employers will say, well, work stress, don't care, we don't have solid data, we don't need to do anything. But if there is convincing scientific evidence, then I think really the employers are forced to observe these facts and to do something to prevent work-related diseases. So we have 3 sources of evidence in science how to study the links between work stress and health. And the most important one is the epidemiological cohort studies, which is a very long-standing research, because there are large population groups which have to be healthy at the beginning, and then we measure the exposure at the beginning, and then we see whether those with high levels of stress have an elevated risk of getting some of these diseases. This is probably the first study, a very famous study. It's the Whitehall 2 study from the United Kingdom. And we have been invited to test our model of high effort and low reward, and also to see whether it is distinct from the other more established model of job strain. And you can see both models. Just look at the red columns, because they are adjusted for other risk factors. And you can see both those employees who suffer from high effort and low reward at work and those who suffer from low control have an elevated risk of coronary heart disease within a 5-year follow-up period. Now, not all studies, there are many studies now this is for the demand control model, which were conducted prospectively. Not all have elevated risks by 100%. Some, I think, mostly now it is about 40% if you take all evidence together. So there are about 20 studies, or almost 30 studies, analyzing the relative risk of incident coronary heart disease following exposure to one of these two work stress models, and the relative risk is elevated by about 40%. 40% is not much, but it's still significantly elevated. And even worse, those who come back after they recovered from their first myocardial infarction and can come back to work and suffer from work stress again, their risk is even higher with 60%. As I said, 40% increase is not so much, but look, about every fourth employed person is exposed to either high job strain or high effort-reward imbalance. And this is quite substantial in terms of public health. So I'm skipping this because we don't have much time, but we can also show that there are cardiovascular risk factors which are affected. This is a study which shows that those with low control have higher blood pressure throughout the working day than those with low or no control. And the other illness or disease is depression, and as you know, this is a very important public health problem. I will not go into details here because it's known to many of you that this is a highly prevalent and important disorders. Although depression is more prevalent among women than among men, the effect of work stress on depression is quite similar between men and women. This is an example from a study from Canada, and you can show left side men and on the right side women, and those with the highest level of work stress, this is the fourth quartile, they have an increased risk of depression. And again, we can say there are now many studies, prospective studies, analyzing the link between work stress and depression. There are more than 20 studies taken together, and we see that the relative risk is about 70% increased, which again, in a public health perspective, is substantial. This is probably the first study showing that these two models, effort-reward imbalance is the blue one, and the dark blue is the low control from the demand control model, that there are elevated risks of depressive symptoms throughout the world. We had the opportunity of studying older workers in the US, in Europe, and in Japan. And in all three continents, there's an increased risk of suffering from depressive symptoms if you are exposed to work stress. And again, it does affect the body. As you can see on the left side, for men, it is a significant difference. For women, it's just a trend. That those who suffer from work stress, their immune system is affected. So there are less natural killer cells which fight against the cancer cells in your body. Now, coming to the final question, to the third question. Given this evidence on associations between work stress as measured by these models and health as measured by coronary heart disease and depression, what can be done? What should be done? And I think we have two levels where action should take place. The first is the level of companies and of organizations. And there again, we have different levels where you can approach, where you can locate your actions. Of course, you can offer personal programs of stress prevention, relaxation, and so on. You can do something to improve leadership and to improve communication and collaboration. But probably more important in the long run would be to do structural interventions. And these interventions could be to some extent instructed by the theoretical models I was just talking about. And these are a few examples. Maybe we can come back during the panel discussion on what can be done and where to go in order to improve the health of working people. I just want to give you one small example of a real intervention study from Canada. It's an experimental study in a hospital, and you see the control hospital. And in the experimental hospital, they try to reduce the demand for nurses, for physicians, and to improve the control, to improve social reward and social support and reward, and to reduce the imbalance. And you can see, even after 3 years, it's a 36-month follow-up, in the experimental group, the work-related burnout level in these professions was significantly lower than it was in a control hospital where nothing changed, where nothing was improved. The second level to tackle these challenges is the level of national and also international policies. And here, I think it is important to reduce non-standard employment, to enforce fair work standards in international trade contracts. It is important to strengthen the legislation on fixed-term contracts, something which is important now at the European level, and to improve the working conditions in atypical non-standard employment, for instance, in the gig economy. We should also promote voluntary agreements between employers and employees and extend the social dialogue. And importantly, we should maintain and develop distinct national and labor social policies, which means to secure the welfare regimes which provide basic social and economic protection, access to healthcare and further education. Just to sum up, I want to say we did one study showing that among those countries where there is a well-developed integration policy, integration of unemployed, integration of women coming back to work and so on. So where there is an extended social integration policy like Sweden, like Denmark and Germany, there's also a very good quality of work. In countries like Czechia, Poland, Italy, Greece, where there is very poor working conditions, there's at the same time also very poor efforts to do integration policy. So to conclude, I would say in times of economic threats and challenges, it is essential to promote healthy work at the local, at the national, like here with Forte, and at the international level. Hopefully, new scientific evidence, research evidence on the impact of work stress on workers' health can be used to this end. And investing, I think this is an important message, investing in good quality of work and employment pays off, not only for workers' health, but also in social and even in economic terms. So then I think the conclusion is try to do something, and if you started already, do more and do better. Thank you very much.
Thank you very much for this. Do something, do more, and do better. That's a good conclusion.
Yeah.
Now, you were talking about two levels, the company level and the policy level, national and international. And you were also talking about reducing the effects and prevention. What is most important to work with? Or you should work with both, but...
Yeah, I think... one thing I wasn't able to address in this short communication is the social inequality. We see a huge social gradient. The higher up you are on the level with your work, the better is not only the quality of work, but the better is your health. And the more you go down on the level in the social structure, you see the accumulation of risks, of health risks and also of poor working conditions. So I would say both in terms of what companies should do, in a way they should prioritize according to need. And also at the national level, I think there should be distinct programs. It was talked about this earlier this afternoon. There should be targeted interventions and policy measures to reduce this inequality. I think this is an important issue.
You said Sweden was high up. Sweden
Yeah.
is doing well.
Right.
Could we learn something still from other countries?
Well, I was just by chance, I was learning that actually, if you go into the smaller and middle enterprises, not the big international companies, but in the small and middle, where many people are working, that there, for instance, the occupational health services are not so well developed, are understaffed. So I think there is a need to improve health and safety measures, in particular for these middle and low companies, and also for all these people who are not protected, like these new developments, self-made people or people working in the gig economy where there's no protection. So I think these are also challenges for Sweden.
So small and medium-sized companies and also the people not having full employment.
Yeah.
If you should say something that Sweden is really good at that you could learn from in Germany or other countries, what would you take? What's the best thing Sweden has done in this area that you could actually learn?
I think, well, Sweden has done an excellent job in concerning gender. I mean, I pointed to some improvements, options of improvement. But in terms of integrating women into the labor market, providing similar rights, I think Sweden is really at the forefront, and we can, in particular in Germany, we can learn a lot because we are just very much back, at least in Western Germany, where women were for too long time were kept out of the workforce, so from the labor market. So that's a good message from Sweden.
Yeah, that's learning from each other. Thank you very much for joining us today,
Okay,
Professor
thank you.
Johannes.